afternoon, Senator Giarratana and members of the committee. Thank you for the opportunity to address you today. My name is John Brady, and I'm a registered nurse working in the emergency department at Backus Hospital in Norwich. I've come before you today to ask for your help. My colleagues and I face danger of physical and verbal attacks on a daily basis. It is critical to our safety that Connecticut's workplace violence laws be strong. Those who dedicate themselves to the care of others need and deserve the ability to work without our lives being threatened. I have seen verbal and physical attacks against nurses and other healthcare workers leave them so traumatized that they have left bedside nursing. I'd like to share with you one example. The patient was a big man, well over 6 feet tall. His arms were so large that when we took his blood pressure, the cuff did not encircle his upper arm, and we had to use his forearm instead. He was depressed and had expressed thoughts of suicide to a friend. He was changed out of his street clothes and placed under constant observation. He waited in his seclusion room, laying on a stretcher, his back towards the camera used to observe him. He had been waiting for a couple of hours for the psych clinician to speak to him, when suddenly the person observing him yelled for help. With his back to the camera, the patient had managed to tie the bed sheet into a noose, tie it to the stretcher rail, place it around his neck, and was starting to lay himself on the floor. I rushed to the bedside and struggled to pull the noose up over his head. Somehow I was successful. At this point, he jumped to his feet, wrapped his massive forearm around my head, pulling my head towards his waist in a headlock. To this day, I do not know why he didn't snap my neck. Maybe he only wanted attention. Maybe it was because I was too afraid to resist or too weak to break his hold. Or maybe I'm here today only because security arrived just in time to prevent it. It's taken me time to recover emotionally from this attack, and yet under the proposed changes, I'm not sure it would even meet the definition of an act of violence. There was no loss of life, consciousness, injury requiring treatment, impediment of my breathing or blood circulation, nor was I restrained by the throat or neck or verbally threatened. Yet with one twist of my head, he could have snapped my neck. It's one example of what happens day in and day out in Connecticut hospitals. Healthcare workers are often discouraged from reporting to police.
Thank you, Mr. Brady. Can you summarize, please?
I urge you to keep the workplace violence laws strong for my sake, the sake of my colleagues, the sake of our patients, and the visitors to the hospital. Thank you for your time.
Thank you very much. Are there any questions?